planning to regrow it because my wife said she would rather have me with the beard. But I quite fancy regrowing it too. Well, on to what I'm going to say today. And let me just tell you why this has come about, really. It's come about from a bit of general reading and listening on the internet to various terms that are used. And I always used to think that these terms should surely only be used in workplaces. Let me start with one in particular. Business. Let me just extend that a little bit further. And let's put business model. Now, I always would accept that, fair enough, if you are actually setting up a business, if you're going to go on to The Apprentice or whatever, and you're going to produce something for Sir Alan, or you're going to be producing something for your bank or something so they'll lend you the capital, well, yeah, I think a business model would be a pretty smart thing, pretty much like some of those kind of graphics that we showed you in the beginning there. Yeah, I could live with having a business model for that. But the problem I see is that this business model is being translated into absolutely everything. Everything from what goes on with your, in my case, Norfolk County Council, to what goes on with your healthcare service, with our, and I stress the word, our National Health Service. It's all got to have a business model, because it's seen now, talking about our National Health Service, as a business. It already has stakeholders. It already has customers. Hang on a second. I thought we were patients. I thought we were the people who the National Health Service was looking after. I didn't really see myself as an external customer of the National Health Service. So, have you ever wondered why it is going to be so deadly simple to privatise the NHS? Well, that language is being applied to just about everything we do in society. It's being applied to your kids' schools. The school will have to produce a business model or a business plan for the next so many years. Your GP will have not so much a receptionist now, but a business manager. Everything is being related to business and money. Now, of course, in ordinary businesses, sure, they're set up to make a profit. Sure, you have profit makers. Well, you have profit generators. They tend to be the workers, yeah. And you have shareholders and all that lot. And the business is in business to make a profit, yeah. So we're quite used to that model, okay? But let's take the NHS. It's not reasonable to run it on some kind of bloody business model. It's about saving lives. It's about healthcare. It's not about putting so many pennies away in the bank account. It's not about being accountable to your shareholders, because we're all the damn shareholders. Don't you pay tax and national insurance? So look, something I just thought about from reading around. How easy is it to privatise something, to have it run as a business, when constantly we are encouraged to think about everything as a damn business, and we are the customers and they are the business, and we want value for money? The National Health Service is a service. It belongs to, it is owned by all of us. We're all stakeholders. It's our national health. And we do not want it run and transferred over to an economic model developed in America and private business stakeholders. It is not, never has been, and never should be run for profit. It should be run for us all, and we've paid for that. So just think about that next time they talk about, and people like Farage come on saying, well, look, I think we need to move towards a private insurance system. Just think about that, yeah? Everything is becoming a damn business.